Hello, I'm Dr. Ashok Kumar, Head Department of Zoology, Ganga Singh College, Chapra, running under JP University, Bihar. Today I'm going to switch on the topic diseases, bacterial diseases. I had already explained 5 bacterial diseases like tail and fin rot disease, ulcer disease, columnaries disease, eye disease of katla, and columnaries disease. Now today I'm explaining a new disease found in salmon or trout in salmon, that is furunculosis. Furunculosis is a disease caused by Aeromonas salmonicida. Aeromonas causative agent is bacteria Aeromonas salmonicida. It causes furunculosis. Furuncles means boils. These boils occur on the dorsal surface of the body of salmon treta, salmo ferio, salmo fontanalis, salmo iridius, and salmo salas, salmo ferio, salmo salvelinus, and salmo iridius. These are the 4 species which are infected by this bacteria Aeromonas salmonicida. Almost this infection, this bacteria invades the 9 families of this Salmonidae, and it is very much it causes mass mortality takes place due to its infection, and so the different varieties victims of this Aeromonas salmonicida are salmon species, and the typical symptom is boils and ulcers. Boils means papola. Boils and ulcers, they are found on the body surface. These boils are remain in isolated patches or in groups. So many boils remain present. So it is called furunculosis. Furuncles means boils. So it occurs in here. Swim bladder becomes hyperemic, means swim bladder become, and in liver spots and hemorrhages. In the liver of fish, spots are found and hemorrhages are found in the liver. So autopsy by autopsy we see the inflation in pyloric and rectal regions. So the typical pyloric is, but externally we see the furuncles or boils and ulcers, which are on the dorsal region. The ulcers are tinged with blood. वो अल्सर घाव जो है उससे ब्लड आता है. The bigger ulcers contain very dark, sticky, reddish pus. This Aeromonas salmonicida infect the fish, infect the salmon variety and genus salmon, and this salmon causes the disease furunculosis in large boils as well as ulcers on the dorsal surface, and this in advanced stages the pus which is dark and sticky that appears. Ulcers may be absent, and in such an event autopsy shows intestinal inflammation, principally in the pyloric and rectal regions. Especially in pyloric and rectal regions, the intestinal inflammation occurs. The autopsy shows, and the spots are found in liver as well as hemorrhages are also found in liver. Spots as well as hemorrhages are also found on the further. Similar hemorrhages are also found on the inner side of the operculum as well as eyes as well as fins. So these and swim bladder becomes hyperemic. As swim bladder becomes hyperemic means extended swim bladder. So in the event of bacteremia, a stage occurs when it is called bacteremia. There is no external symptoms usually lacking. External symptoms are lacking, but the blood remains filled with bacteria Aeromonas salmonicida. So in bacterial hemorrhagic septicemia, like in bacterial hemorrhagic septicemia and viral hemorrhagic septicemia, BHS and VHS, the furunculosis may be differentiated into three stages. First is ulcerative form. The first is ulcerative form, and that is the slow course. That is simply simply boils or ulcers are visible on the skin. Second is asymptomatic form. Asymptomatic form, that is acute form, in which the blood acute forms in which the inflammation in different enteric region as well as blood remains filled with bacteria Aeromonas salmonicida bacterium. So it is called bacteremia. In bacteremia, this symptom, second is this is asymptomatic form, and third is intestinal form, in which enteritis and anal prolapse takes place. The bacteria attack principally fish of 2 years or more. The bacteria attack principally fish of 2 years or more. Young alevins may also be infected. But in this disease, it remains in the latent form. It will appear when the alevins will become adult. Then it will appear, but in alevins it remains latent, hidden. So the bacteria remain dormant in this bacteria Aeromonas salmonicida. This remains hidden in the healthy fish. It remains dormant or hidden in the healthy fish. But in weakened fish or the fish in a bad aquatic environment, when water quality becomes water quality becomes deteriorated. Under that condition, this in weakened fishes they become dead. So death may occur within a few days following the attack of the disease. Death is very common when the attack of this disease takes place. So mass mortality has been reported. Mass mortality has been reported in the case of the trouts or different variety of salmo or trouts. This disease has been observed at least in 9 families. One thing about Aeromonas salmonicida, that is, this bacteria grows between 20 to 30 degrees Celsius, but it dies at 37 degrees Celsius. So but it remains in ubiquitous. It is ubiquitous means in abundance. It remains in abundance in the bottom of the pond, and also in mud. Often it is often in very large numbers they are found. Often in very large numbers. Now the second is vibriosis. Vibriosis. Vibrio is a bacteria, and it is of and different variety of Vibrio has been found, and they are mostly all types of infections caused by this virus, genus Vibrio, including bacterial cell disease, bag gill disease, and hepatopancreatic disease. These are caused by the different in shrimp. In different variety of shrimp. And the bacteria are the species of genus Vibrio. Bacteria which they are of different types: Vibrio cholerae, Vibrio alginolyticus, Vibrio parahemolyticus, Vibrio vulnificus, Vibrio angularium, Vibrio fluvius. So these are the varieties: Vibrio alginolyticus, Vibrio vulnificus, Vibrio parahemolyticus, Vibrio angularium, and Vibrio fluvius. So this is frequently encountered in cultured shrimps, and a majority of stressed shrimps have presence of Vibrio. Since Vibrio species are opportunist pathogens, they cause disease, hence they attack stressed shrimps. The following types of diseases have been encountered in shrimp caused by Vibrio species, different species of Vibrio. These are 3 types. One is 1 month mortality syndrome. 1 month mortality syndrome. Second is black spot disease, and third is septic hepatopancreatic necrosis. So these are the 3 types of diseases: 1 month mortality syndrome, black spot diseases, and septic hepatopancreatic necrosis. These are the 3 types of. Now, 1 month mortality syndrome. Sudden mortality in young shrimps, that is Penis monodon. In 1 month, sudden mortality takes place in Penis monodon, that is a type of shrimp, within a month of infection. During early stage of shrimp culture, death of benthic alga takes place. During early stage of culture, death of benthic alga takes place, and the decomposing material are formed at the pond bottom. The young shrimps, Penis monodon, after molting, come in contact with these decomposing materials, on which profuse number of Vibrio species is developed. These in the benthic zone, there remains a large number of Vibrio bacteria in profuse number, and the Vibrio infect the stress shellfish, that is Penis monodon, and which die within a month. So this disease is called 1 month mortality syndrome. Second is black spot disease. Black spot disease, the external symptoms of black lesions are visible in muscles. In muscles, black lesions are visible in muscles, in the abdomen, in muscles, in the abdomen, in the gill, and other organs of the Penis monodon, as well as giant freshwater prawn, that is Macrobrachium rosenbergi. So Penis monodon as well as Macrobrachium rosenbergi both becomes victim of this Vibrio species. Deteriorating water quality and stress prone and proliferation of Vibrio species present in water. These Vibrio species are present in ubiquitous. They are ubiquitous, means in abundance in water, and as a result of chronic Vibrio species infection takes place there, and development of black areas occur due to the deposition of melanin pigment in the gills, in the body, in the so this is called black spot disease. Third is septic hepatopancreatic necrosis. This is in this disease, certain portion in the septic hepatopancreatic necrosis, certain portion of the hepatopancreas turn black, and they are degenerative in Penis monodon. Causative agent is deteriorating water quality. And the stress prone and proliferation of Vibrio species present in water occur. These results in the Vibrio species infection. These are the infection in the hepatopancreas. The proliferation of Vibrio species occur, and these results in Vibrio species infection in hepatopancreas. The species of genus Vibrio associated with vibriosis in India are Vibrio parahemolyticus, Vibrio alginolyticus, Vibrio angularium, and Vibrio vulnificus, and Vibrio fluvials. So these are the important. Now one thing I would like, how treatment of vibriosis takes place. Vibriosis is associated with the bad water quality in the culture area of shrimps. Most of the stress shrimp have some Vibrio species infection. So water quality improvement is the best method, the management practice to adopt. Then after that, so prophylactic maintenance of proper water quality with low bacterial biomass. Second is constant phytoplankton bloom, and balanced feeding schedule is maintained. Third is regular monitoring of shrimp and water quality. Therapeutic, that is antibiotic oxytetracycline or erythromycin should be applied for 5 days at the rate of 50 to 90 ppm bath treatment and 500 to 1000 milligram per kg feed treatment. These are the treatment for vibriosis, and the treatment for control of furunculosis are that is immunizing, immunization, it is for control of furunculosis, immunization and chemotherapy with sulfonamide. With sulfonamide have been found. Sulfonamide have been found effective. Effective. Antibiotics and nitrofuran have been found effective in controlling outbreak of furunculosis. This is all about the bacterial diseases. Found encountered in fish as well as shrimp or shellfish, and that is all. And it is very much important from the examination point of view, from the culture point of view for fish farmers, and this is all about the bacterial disease has been ended. Thank you, thank you, thank you.